I think it's a fun topic about being triggered as a doctor, and specifically how Generation Z really gets under our skin in a completely respectful and compassionate way, because everyone triggers their doctors. Gen Z does it a little bit differently though. So I'm Dr. Anthony Kaveh, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist. And in this operating room where we literally wipe your memories, we do these crazy things to you on the operating room table. You think that doctors are always cool and calm, and we usually are outwardly, but sometimes some patients get under our skin. I'm going to be completely honest with you. We're human beings, and I'll give you an example. I'm going to actually give you 3 examples, but the one that really stands out is when I call patients the night before surgery and they sound like they're in a different planet. I'm like, I'm Dr. Kaveh. I'm going to be your anesthesiologist tomorrow. Oh, surgery. Yeah, your surgery with Dr. So-and-so. And I ask my questions, and at the end they say, so I'm going to be asleep for surgery, right? And I'm like, serenity now, to myself in my head. And I mean, yeah, it's with all respect. I understand surgery is an incredibly stressful experience, no question about it. There's a lot of vulnerability that goes into it. Yet the next day when that same patient apologizes and says, Doc, I'm so sorry I wasn't really with you. I was actually smoking a joint with some buddies. How do you think that makes us feel when we're here managing your life, your consciousness, your body, your heart, your brain during surgery, and we interact with you the night before when you're smoking with some friends? Well, these are the things that get under our skin as doctors. But before I tell you the other 2 things, we have to first remember that Generation Z is like every generation. They do things that trigger others. And to recap, triggering is hijacking your central nervous system. I say it's hijacking because it's a form of manipulation where a small stimulus literally takes over someone else's central nervous system, their brain, brainstem, and spinal cord. It can cause heart rate elevations, pupillary dilation, sweaty palms, your blood pressure to go through the roof. And this can be serious if it causes us to relive past memories, for example, through PTSD, have flashbacks, lead to nightmares that night, etc. So it's like something outside your body having an exuberant response within your body. Very, very serious, and everyone can do this. But Gen Z does it in a way that's different because they have different stressors than any other generation. They have to deal with stuff that no other generation has dealt with. And they have often maladaptive coping mechanisms like every generation, but they're not old enough to have developed the wisdom to transform those maladaptive coping mechanisms into more healthy adaptive mechanisms. Not their fault. To be perfectly clear, every generation has had problems, but these are a little bit more interesting, I think you'll find. Coach Ken, thank you for that. Thank you. And veterans and PTSD prone to emergence delirium and being combative. I actually have a whole live on that. You should check it out. But I'm happy to talk about that in a future video if you'd like. So number 1 was the cell phone the night before. And to be clear, I've had patients be under the influence of multiple other drugs. This maladaptive coping mechanism is clearly the substance abuse one. It's also the coping mechanism of distraction, of misunderstanding. I don't think it's malicious so much because clearly they're stressed out. Gen Z is incredibly anxious compared to other generations for many very valid reasons. But going towards weed, which is very common in that generation, going towards sleeping aids when their mental health is not ideal. They might not drink alcohol as much, so that is rapidly changing, but they still grab for other substances, stimulants, for example, as well. And these clearly affect your interactions with your doctors before surgery and what happens to you when you're on the table, no question. Jen is having surgery next Friday. I'm wishing you the best for your surgery, and I hope everyone here sends you positive vibes for your surgery as well. So number 2, well, actually I should say, if you're going to smoke, do not use any substances the night before surgery. Please do not. But if you do use something, please tell your anesthesiologist so we can modify the anesthesia, use medications like all those that we have in our drawer here, adapt our ventilator settings like all these medications and settings here so that we keep you safe in light of what you used if we can do it safely. Number 2 is the cell phone during the procedure. We're often doing procedures like with long needles like this guy to do nerve blocks. Can you see how long this is? This is a 6-inch needle. When this is going inside your body for a nerve block to numb your nerves, it's reasonable to want a distraction. But Generation Z, more than any other generation I've ever seen, is super keen on just pulling out their phone and texting away. Now, I recognize that distraction is a coping mechanism, and it can be a powerful one. Heck, why not? Distraction is not good for long-term coping, but for short-term things, I have no issue with that. One of my favorite distractors, by the way, is to ask patients to cough when I'm numbing their skin for IVs or for nerve blocks. But if I'm doing a nerve block with the actual needle going into nerves, a 6-inch needle that is going to be around very precious real estate like your C5, C7, pardon, C5 through 7 for your interscalene, your axillary nerve here, your popliteal nerve if it's knee surgery, anywhere in your body, we need you to be awake and conversing with us. Obviously, I don't want anyone to be in pain or to be uncomfortable. I give plenty of relaxing medication, typically before nerve blocks. So I might give things like midazolam. Thank you, Kimundo, for the super thanks. It's very kind of you, or that super chat. Thank you. I might give fentanyl as well. So I don't want anyone to be uncomfortable purposely when that big needle is going in. But if you're there texting and you're moving your arm, you're going to make my procedure more difficult and increase the risk. Additionally, what's different about me numbing the skin for the IV or the nerve block versus actually placing this long AF needle into the area where the nerve is that's already been numbed is that if we're near a nerve, I need you to tell us if you feel a twinge. If you're so self-absorbed in Instagram or whatever, I'm not making light. These are serious, I understand that it can be anxiety provoking and I want you to be distracted, but not in a way that might distract you from telling us if you feel some irritation while I'm doing the nerve block, because that's important for your doctor to know so we don't harm the nerve. When I'm numbing your skin, I don't need your feedback the way that I do for a nerve block. So there has to be some engagement. We can't do our best for you if you're not present and mindful with us. And I gotta say that the distraction which is there for the substance abuse and for the cell phones during a procedure, they can be powerful in the right context. But the difference between older generations is that older generations sometimes know that, this is gonna be an uncomfortable procedure for a couple of minutes. I've had this done before. I know what to expect. I'm more comfortable with it. Gen Z has not had surgery typically. Of course, there are exceptions. So I'm not saying it's okay to do these types of maladaptive coping mechanisms, but it's important to recognize why they're there in the first place and not blame Generation Z, but try to understand and level with them. That's what I want, right? Of course, I want individuals to feel comfortable. Rush Dwal is asking cell phones in the OR. No, these are cell phones usually in the pre-op area where I'm doing the nerve block before we come in the operating room. So just to be clear, phones are before you get in the operating room. We typically don't allow phones by patients in the operating room here for many reasons, which I've discussed in other videos. But not blaming Gen Z. Blaming is not productive. We want to understand why the coping mechanism is there and try to replace it with something more beneficial. Number 3, and I want your help, please. First off, if you appreciate me coming on live after 12 hours of surgery and sharing these with you, please hit the like button and share what you learned with others, especially if you know people who are in Gen Z. And help me understand this third one, because I really want help in understanding. I did a lot of research. I couldn't find the answer from my observation, and that is eye rolling. When I say certain things to Gen Zers before surgery, I get such a stereotypical look. It's typically when I bring up the power of breathing exercises before surgery, mental preparation before surgery. I'm not blaming them, but I don't know why, compared to older generations, they seem to blow me off when I try to emphasize non-pharmacologic coping mechanisms. Kaiki is saying side eye, yeah, the side eye thing. So I think that they want substances like these. I'm not blaming, but I'm just sharing a thought. It's probably not right for everyone, but I think some individuals mirror the same tendency to reach for sleep aids and stimulants in their non-surgery setting. And then when they come to surgery, it's like, oh, well, I'll just get the sedation. I'll get the propofol or the Versed or the fentanyl. And there's a role for these. I'm not saying to not use them, but how about looking at the whole picture? Because you can't take these things home with you. You can't take propofol home with you, but you can take a empowered mindset home with you. You can take breathing exercises and controlling top-down analgesia home with you. And I think that I'm sometimes viewed as being maybe woo-wooey or not being like real. I know it's not true for all Gen Zers, straight up, because we know that Gen Z tends to actually be quite accepting of these beliefs of, in particular, spirituality. When they come to me for ketamine, some Gen Zers are so ahead of the 8 ball compared to like boomers. I'll be real. Boomers look at me like I'm crazy when they come in for ketamine. Of course, they have amazing benefits in my ketamine clinic, like true transformations. But Gen Z already knows about this. So I know that Gen Z is so aware of the mind-body connection. But before surgery, they just give me these looks like, really, doc? Not all, but many. And I would really love to know your thoughts on why does Gen Z give me that eye roll? Because I can't figure it out because the data doesn't support that. Now, I want to end on a positive note about Gen Z, and I'm going to do a whole video on this because oh, wait, hold on. Sunshine is asking, what is ketamine? Well, ketamine is a powerful, powerful medication that is an anesthetic, but also almost has psychedelic-like properties and can be profoundly transformative for depression, anxiety, PTSD, and chronic pain. Gigi says it's a horse tranquilizer. It is that. It's also a human anesthetic used in infants and elderly. But I have many more videos on that. You should check it out. It is very powerful. And it's very powerful when Gen Zers bring the right mindset, which they do. So I would love your thoughts on the eye roll. But let's end with what I said is something that Gen Z often does that surprises me. Hip chocolate chip. I'm not hating on Gen Z. I'm going to tell you my favorite thing about Gen Z. And I'm going to do a whole video on this, by the way. That I think you're going to really like it because Gen Z is the generation of patients that often surprises me the most in a very positive way. Before I tell you, I need to give a thank you to Parley Gage Reed Marsh. Says maybe arrogance in the youth. I think arrogance can affect any generation. Yeah, I think youth tend to be a little bit more arrogant because there is a sense of invincibility that we all have and have had. So boomers had it when they were young. Millennials still have it. I mean, we all have been through that. So it's not unique to Gen Z. I think it's just because they happen to be in that age group at this time. But to be clear, I am not hating on Gen Z. Gen Z often has patients that come to surgery or to ketamine in really tough situations. They have gone through the pandemic at an age that no one else has. They have gone through all sorts of geopolitical issues that no other generation has in this specific way. Yes, there is a generation that went through World War II. I understand that, but that's different than today. Social media, a loneliness epidemic. Forget COVID, how about an opioid epidemic? All these things have all contributed to Gen Z having a whole different exposure in the fundamentally important part of their brain development. So Gen Z has very different influences and impressions than other generations, yet they often have the most profound self-determination and empowerment. And that's why I need to tell you that those three things kind of trigger me before surgery, but they also surprise me when they break the mold, which they do more often than other generations, and end up actually being far more empowered and having such smooth surgeries, and often wake up with more gratitude than other generations in that similar situation. They wake up saying, "Doc," and to the nurse, to me, the surgeon, whoever, but like, "Thank you." Instead of waking up kicking and screaming, they often wake up, despite their traumas before, wake up together with less delirium and can say, "Wow, I feel really weird under the influence of anesthesia, but thank you. But thank you, doctor." And that just blows my mind that such a vulnerable population has these diamonds in the rough that pull through in ways that I don't see others do. So please don't take this as hating on Gen Z, but as recognizing that there is so many powerful individuals out there that are taking the best of social media, all of these resources available to them across the internet, etc., taking the very best wisdom that is more accessible to them than any other generation because they're digital natives, right? They grew up with the internet. I didn't grow up with the internet. They grew up with more access to information than all of you old boomers, not old boomers, but than anyone else out there. When they take that and use it responsibly, or maybe they take psychedelic treatments and use them responsibly, they can blow everyone else out of the water. I'm very excited to see how they use that in future decades under anesthesia in my ketamine clinic, etc. But that's a whole different video. So please remember that you all have way more power over your health than you have ever been told. Whether you're a boomer, a millennial, a Gen Z, a silent, Gen X, whatever, you have a lot more power in obviously your mind-body connection, but also in how you interact with your doctors and those around you to overcome the loneliness epidemic, opiate epidemic, of course with external support, but also with that internal healing potential. So I hope that you all reach out to a Gen Zer and give them a pat on the back, because they have pulled through a lot. They have a lot to learn, but they have a heck of a lot more potential, I think, than any other generation in this planet. Flow with Joe podcast says millennial in the house. Millennials have those opportunities too, but Gen Z is really breaking the mold in ways that I find very inspiring, despite them triggering me. Also, if your anesthesiologist is calling you the night before surgery, don't talk to them if you're high on weed. Just ask that you call them back after you're done. That might be a word of wisdom to anyone having surgery in the future. So till next time, you have more power over your health than you've ever been told. Take care.